Most spondylolisthesis is a forward slippage of the vertebrae, and the fact that there is an anterior shear component to these anterior shear forces can be very destructive to the spine. We want to reduce the anterior shear force. So a couple ways to do that. Number one is stretching the hip flexors. Tightness in front of the hips increases anterior shear forces on the spine. Second is we want to strengthen those deep abdominals, almost more going into more of a posterior pelvic tilt to try to reduce that anterior shear. Now, good news with spondylolisthesis, here's a study that showed prevalence is approximately 11% in the population to see these slippages. What's interesting is this study showed that there's no increased prevalence of low back pain with people who have spondylolisthesis, and that's been my experience as a physical therapist. The cases I see remind me of typical degenerative instabilities I see. The other thing with them is I find they're just as rehabable as typically a degenerative instability or a typical low back problem is.